Hi guys, this is Dr. Shannon Clark with Babies After 35. We are going to talk about dental health and pregnancy today and ask a lot of questions. This topic has actually gotten a lot of traction, or whatever we're going to call it, a lot of attention. I've done some videos and shared them on TikTok and on Instagram. And I'm sorry I didn't do this topic earlier because there are a lot of questions out there and I can't wait. Dr. Sarah Lorei is going to join me. And she is a dentist on TikTok and Instagram. There she is. Let me add you in. There you are. Stock here in a second.
Hi
there. How
Can you hear me?
Doing? I can hear you perfectly.
We on live.
We on live. That's right. So I was just telling them I virtually met you first through TikTok at Dr. Sarah Lorei. She has some amazing content there. And then also on Instagram. And I was telling them that this topic has actually gotten a lot of attention and a lot of questions. And I feel bad that I didn't address it earlier, but I guess it's something that's not really talked about. Would you agree?
Yeah, I agree. It's kind of sad actually, but yeah. I mean, I'm really excited to be a part of it. Thank you.
Yeah.
And I think people will learn a lot.
Yeah, we're going to talk about, first talk about why dental health, why changes occur in your mouth when you're pregnant, and it does happen. What you can and can't do when you're pregnant. And we're also going to dispel some myths at the end. So let's talk about first. So let's talk about what physiological changes. Pregnancy has a lot of physiological changes in the entire body. Okay, and your mouth is no exception. So what are some of the more common things that we see physiologically that occur with pregnancy as far as the dental health and the gums and everything?
Well, there's a lot of demands when you're pregnant. Pregnancy demands, women have morning sickness, and so they are throwing up more. So they have lots of acids. They have reflux, acids coming up in the mouth that are, eating away at their teeth. We have changes in diet as well when we're pregnant because, cravings, people eat more sugars, the sugars lead to cavities. We have increased hormones in pregnancy, and those hormones lead to increased swelling in the gums, and the inflammation is just exacerbated,
Yeah. And the inflammation in the gums from swelling, which people don't really think about. We know our legs get swollen. We know things like, that happens in pregnancy, but our gums do get swollen. So what I understand is that can allow trapping of food. And that can lead to right from some of the swelling, or if you're not, not getting all the food out.
The food leads to the swelling. So just like to understand how it happens, you have to understand like the body, how it responds to trauma or injury. When you get a cut, your body sends blood there to fix it because what's in our blood fixes it, the platelets, etc. And then you'll get swelling because of the, increased blood supply to that area and such. Same thing in the mouth. When we have debris left over in between our teeth, if we don't brush our teeth, our gums, they want to fix that area. Our body wants to fix it. It sends blood there to fix it, but it can't. It just needs to be brushed off, flossed off, So constantly sending blood to an area that is injured or trying to fix it, and it can't. So that's why when you do floss, when you have swollen gums, you bleed.
You might bleed more, yeah.
Right. So just understanding, like, initially that's what causes the swelling, and it's your body trying to repair itself, but it can't. So,
and you also mentioned, and I see this a lot with my patients that have nausea, vomiting, or pregnancy, or morning sickness, and also the ones that have the more severe form, which is hyperemesis. You mentioned about having vomiting and a lot of reflux with those conditions causes the overall oral cavity to be more acidic, which is what we don't want. So if you already have an acidic, your mouth is becoming more acidic, and then you might have plaque that's already there before you even got pregnant. The acid's going to make it even worse, and that can predispose you to having more bacteria, which could lead to more irritation with the gums, cavities, and make things worse. So one of the things we tell patients is we need to make sure we address, and I know it's the last thing you want to think about when you're throwing up for the first several months of your pregnancy, but we still have to take care of our teeth. because I've seen several women with nausea and vomiting had dental issues later on in the pregnancy. And one of the things we tell them, you could correct me if I'm wrong, that you can rinse with, if you are having episodes of vomiting, as soon as you can, rinse your mouth with water to try to get some of that acid out of your mouth. And what's this about washing? And then you recommend washing with like a mild mouthwash with fluoride. Would that help as well?
That helps. You know, they say don't brush your teeth right after you throw up because of the acid. You're going to rub off the enamel off your teeth. Okay. So when you do rinse with water, get some of that acids off your teeth and that just disgusting taste off your mouth. But yes, if you use a mouth rinse that has no alcohol but has fluoride in it, the fluoride will help strengthen that enamel so it's not broken down by the acids that are coming up.
And then the other thing is sugar-free gum. So sugar-free gum, and actually chewing gum is one of the conservative measures we tell women with nausea and vomiting to help decrease the episodes of nausea. So chewing a sugar-free gum will also help to increase the pH of your oral cavity as well. So that's another thing that you can do. So yeah, we have the, nausea, vomiting of pregnancy, early in pregnancy, that can cause, your mouth to be more acidic, acid erosion of your teeth. We have the physiological changes with the swellings of the gums, and then the dietary habits, because you do get cravings. And for a lot of women, the cravings are more sugary based. So what you normally wouldn't have eaten when you're not pregnant, you might be more willing to eat when you are pregnant. So we have to keep that in mind, that a lot of our diets change. The one thing I want to ask you about is that we hear something that's called pregnancy gingivitis. What is that?
Well, everybody has a little bit of gingivitis, all of us do. It's just inflammation of the gums. But during pregnancy, it is increased, okay? So you see it more and worse than you do it when you're not pregnant. And usually, again, it's because of the hormones. A lot of nursing moms will also have it, okay? But, some insurances will cover a third cleaning in a year because they understand that this is a problem, know. So it's important to know that, when you are going to your dentist, that your insurance benefits may include an additional cleaning because, they do acknowledge that is a problem. So
I read a statistic that nearly 60 to 75% of pregnant women have gingivitis or get it when they're pregnant. And if you have some issues with your overall oral health before you get pregnant, and then you add that on top of it, you're more likely to have more predisposing to cavities and making it worse when you're pregnant. And then the other thing is, and let's just say it, women traditionally avoid the dentist when they're pregnant. And I am not sure why. We want to try to dispel that here, that we
want to say do more, go more.
You need to, because, and we'll get into this later about more of the importance for the pregnancy itself as for having good dental health. But don't avoid the dentist. Get your routine dental care, your routine exams, whatever you were supposed to be doing, still get when you're pregnant. And we'll talk about that a little bit more. The other thing that I wanted to see, we were talking about, one of the other things that we don't really talk about is that your teeth can get loose when you're pregnant, and that's from the hormonal changes too. So you might have more mobility in your teeth, so you might feel that. And let's talk about cavities. We already touched on it a little bit. With everything that we just said, obviously that's going to predispose you to cavities, but another statistic I saw about cavities is this. 1 in 4 women of childbearing age have untreated cavities. That's a lot of women that are potentially getting pregnant that already have cavities, and then they add pregnancy on top of that. They're not seeing their dentist. They have all these other changes that are going to make their dental oral health worse. And then I've seen tons of women in the second and third trimester that are having abscesses, that are having really leftover untreated dental conditions that have just been neglected. So do you see that a lot?
I see that a lot. I mean, if you're going to neglect your care and not go in regularly, and it gets worse during pregnancy, we can't just say it was because of pregnancy. It could have been, addressed earlier, but because of pregnancy and all the stuff we talked about and the eating more sugars and things, it speeds things up a lot. Of course. How cavities form is, the bacteria in our mouth, they feed off of the sugars. So they eat the sugars in our mouth, and then they basically poop out acids. So they secrete acids, and that's what breaks down our teeth and, you know, gives us cavities. So I think you don't get that just because you're pregnant.
Right.
But, you know, I do see.
Yeah, there's usually something already going on, and the pregnancy makes it worse. It's not like, oh, I had a perfect dental health, and then all of a sudden I'm needing a root canal when I'm 28 weeks. These are things that are probably going on. So moral of the story is this. Number one, get your dental health, you know, but especially if you're trying to conceive or reproductive age, make sure you're getting, just like you would do your pap smear, just like you would do anything else, get your dental health addressed and do your annual exams, or get your teeth cleanings. I get mine cleaned 3 to 4 times a year. And that's because everybody in my family gets plaque really easily, and I'm one of them. But, you know, like Dr. Lorei said, your insurance will likely cover 2 to 3 cleanings a year, and may even add an extra one when you're pregnant. So always check and see what your dental coverage will allow.
Definitely getting, you know, dentally healthy before trying to conceive is really important. We were talking about the inflammation in the gums. You know, when you have that and you bleed, you know, what's in your mouth travels through the rest of your body. It can actually target your fetus, you know. So
we'll talk healthy
like that is important.
Yeah, and you know, we think about everything else when we're trying to conceive. We want to exercise, do everything, but we don't really think about our teeth, and we need to think about that. So there's, you know, it's a total package here. We got to think about everything. So let's go. We already talked about preventative dental cleanings and annual exams are not only safe, but they're recommended. So we need to keep doing those. Now let's talk about the dreaded, can I get a dental x-ray when I'm pregnant?
Absolutely. So we use shields. And in my office, we're digital, and I think a lot of people are going away from film and into digital. The radiation is less, the exposure time is less, and, you know, again, we shield. Now, we're not going to sit there and take a full series of unnecessary x-rays, but when you come in for an emergency, we can definitely take an x-ray. And
it's especially true if there's a condition that needs to be addressed. You know, if you haven't had any issues, you beginning routine care, and you talk to your dentist, they may decide to just, you know, we'll clean your teeth. You haven't had any issues. We can wait till later in pregnancy. But if you have an active issue and they need to see with an x-ray, that is safe in pregnancy. So I want women to understand that, you know, and it's hard to tell a woman, you know, you have a cavity, you need a root canal, you do this without getting an x-ray. So they're going to recommend that. So we just want to let people know that it is safe. So anything that requires immediate treatment, some of the things like if you need like I said, a root canal, an extraction, anything like that, it's ideal to get your x-rays so that the dentist can do what they need to do. The other thing is, you know, you hear that you want to get it done in a second trimester. And that's not because of risk to baby. Well, that's because as you get into the 3rd trimester and you're laying on your back, you know, a lot of women get woozy because the uterus is big. So that's why if you're needing dental care, get it done the 2nd trimester, because that big uterus is not pushing down on your blood flow and making you get lightheaded. So that's why, not because there's a more specific risk to the baby in the 3rd trimester. Okay, what else? Oh, let's talk about elective treatments. What if I'm like 16 weeks and I want to get my teeth whitened, or I want to get cosmetic procedures? Is that something I should wait for?
Definitely. I don't really recommend bleaching your teeth, you know, while you're pregnant, or honestly going back to the having morning sickness and stuff. Who really wants to do that? But if they do, you know, I don't recommend doing any cosmetic work or bleaching teeth. No.
So anything elective, meaning it's not necessary, but maybe you are someone who likes to get their teeth whitened before pregnancy. You might do it while you're, before you're deciding to try to conceive, and then wait until after you've delivered. So elective treatments are discouraged because they're not medically necessary to do when you're pregnant. Okay, next question is medications. You know, and I get that women want to avoid things that's not necessary, but I'm going to make this argument. If you had a urinary tract infection and you need an antibiotic, you're going to take it because you don't want it to get to pyelonephritis or a kidney infection, which can put you in the hospital. That's why we're very aggressive with treating women with urinary symptoms. Same thing. If you have a dental condition where your tooth is really inflamed and it's an infection or potentially an infection and you need an antibiotic, should they take it?
Yes. When the benefits outweigh the potential risks, we take it. Definitely.
Yeah. So if it's recommended that you take an antibiotic, there are plenty of antibiotics that are safe in pregnancy in all trimesters. And if you need it, you should take it, because the consequences of the infection getting worse, causing an abscess to where you need a much bigger procedure, are much greater than taking an antibiotic. So I just want women to understand that is safe. The other thing is that if they need to go have a cavity fixed or a broken tooth, or, worst case scenario, a root canal or a tooth pulled, what do you guys typically recommend as far as, obviously, for pain? What can we give them for pain?
We can do the most I've ever given, is like Tylenol with codeine.
For the actual extract, like for the actual extraction.
Oh, you mean lidocaine?
Yeah, lidocaine.
Yes, you can do lidocaine, and you can do lidocaine even with epinephrine. Some people choose not to use the epinephrine, but it is safe to do that.
It is a local
half-life is
anesthesia,
like 90 minutes,
And it is a local anesthesia. And if it's needed in order to have dental work done because your dental condition is causing you pain, infection, inflammation, and making things worse, then you need to have that addressed. So, giving lidocaine in pregnancy is perfectly safe for those indications. Of course, we want to give is the least amount we need. It's like we're going to give you a bunch of lidocaine you don't need, and that's not going to happen. So, we keep in mind how much you need and make sure you're comfortable. The other thing to remember too is that if you have, and I've seen someone with some really painful dental conditions, and that is stressful, and that's stressful on the pregnancy. So, right?
Sometimes, the infection itself, when we do give an antibiotic, it does not fix the situation. Yes. With dental, when you get an antibiotic, you're either going to get a root canal or get the tooth pulled is the only way to get rid of that infection. So sometimes when they have a serious infection, a massive infection, we do need them on antibiotics initially because the anesthetic doesn't really work in that environment, so we do that to make them a little bit more comfortable so we can numb them and we can do the work.
Yeah. And also that, being in pain or being in pain during a procedure, we want to get you comfortable so that it's not stressful to you or the baby. Right. So if you need lidocaine and you need pain medication after, that is something that, needs to be done for you and for baby.
I always call the pharmacist too. Yeah, I do. Not just the OB, but when I prescribe pregnant, I just call and just make sure I'm giving them this. Do you see anything, contraindicating? And
and as far as, we already touched on the antibiotics, there are plenty that we can give for all indications, and needing it for dental health is no different than if you had any other infection in your body while you're pregnant. And there are actually consequences of leaving your infections in your mouth untreated, and we'll get to that. And we already talked about the x-rays. So one other thing I have the whole thing there. The cavities. We talked about the 1 in 4 cavities. And then, so we hear a lot about periodontal. Is it periodontal disease or periodontitis? Okay, it's a big word.
Periodontitis.
So what's the difference between that and gingivitis?
So gingivitis is just like the inflammation of the gums. And if you do better, with brushing and flossing, your gum swelling will go down. So periodontitis, it is an advanced form where that swelling, where that it actually, there's destruction of the gums and the bones supporting the teeth. So it's inflammation that affects the gums and also eats away at the bones that support your teeth, and that's how people lose their teeth, become loose over time. So that is no condition.
Sorry, you cut off. So I had a phone call come in, so it cut you off. So you said it can cause the teeth to decay, and that's how people can lose their teeth.
It causes the bone. You lose bone. You lose gums. When you see that, loose teeth, more mobility.
Yeah, and then one of the stats that I read was that approximately 40% of pregnant women have some form of periodontal disease. And this is where we're going to get to where it can affect the pregnancy. There have been a lot of studies about periodontal disease or bad oral hygiene and the risk to baby in the pregnancy. And there have been several studies that have suggested that, and potentially there is a cause or a link between, especially periodontal disease and preterm labor, which can lead to low birth weight, and early delivery of babies. So it is important to know that it does exist. And there is a potential complication with preterm labor. And if you have bad periodontal disease or bad cavities or infections in your mouth, because it's a bacterial, it's an environment full of bacteria, and the bacteria can go into the pregnancy and cause you to go into preterm labor. So that's even another reason to make sure we get our dental care when we're pregnant and beforehand. Yeah. Go ahead.
I think they talk a lot about, you know, without really getting into physiology, but you know, with all the inflammation and all the cytokines that are produced, and it is one of the things that leads to the preterm labor, where people, you know, their water breaks early, you know, and that's from those effects.
Well, I mean, I'll use a urinary tract infection thing. You have a urinary tract infection that goes into a kidney infection for whatever reason, that can cause preterm labor and can cause preterm delivery. So any kind of infection in your body that is significant enough, because of the reasons Dr. Lorei said, from the inflammation, the cytokines, you're causing contractions, and then also the actual bacteria, can lead to preterm labor or preterm contractions, which may or may not result in an actual preterm delivery. Yeah. And I have seen that. So I know it does happen. Okay, so let's go to, there were some things I was reading about, one more thing about the x-rays. So the American College of Radiology, ADA, American Dental Association, and ACOG, which is the American College of Obstetricians and Gynecology, all say that when an x-ray is needed in pregnancy to diagnose or treat or help to treat or, you know, make a treatment plan, it is safe to do in pregnancy. With appropriate shielding. So we don't want women thinking that because the dose of radiation and exposure is so minimal, and they don't take a bunch of extra x-rays that they don't need. Right. So just so you know that those three societies all recommend it. And I don't want women thinking that it's not safe.
And it's, you know, part of our exam. You know, when I go see a patient, part of it's a clinical exam. I can take a look and see what's going on, but I can't see in between teeth. I can't see under the gums, you know. So x-rays are really important in diagnosing.
And then there's some suggestions just in general. I have a list here. We already talked about what eating the balanced diet and making sure that we're brushing and flossing, which I'm terrible at, is flossing. But brushing and flossing in pregnancy, getting your routine exams, getting 1 or 2 or even 3 cleanings possibly during the course of your pregnancy is fine. Now, does a woman need to let her dentist know that she's pregnant or trying to conceive? Is that important for you to know?
Oh, I think so. I think it's important for me to know. We can talk a little bit about some of these things, like you said, you know, going over the brushing and flossing, and again, why it's important, you know, morning, night. In the middle of the day, you talked about it a little bit earlier, but chewing sugar-free gum. I always say sugar-free gum with xylitol, it almost replaces toothbrushing in the middle of a day, you know. It helps you produce more saliva. Saliva washes away the bacteria. It buffers the acids in your mouth. So, you know, doing that, using a home rinse with no alcohol, with fluoride added, very good, you know. I'm talking about diet things, you know, making sure they're taking vitamins, that they understand that, you know, your 6th week of pregnancy, the baby's primary teeth are forming, you know, so it's important that they are taking vitamins, supplements, and such, you know.
Yeah, and the whole thing with prenatal vitamins, anybody of reproductive age should be taking. Women that are trying to conceive should be taken. Pregnant women should be taken, and postpartum women should be taking them because they're a good roundabout, if you will, prenatal vitamin that has what you need. And we'll touch here on the postpartum period, because what I see is that things might have been, you may have been able to get through your pregnancy without addressing something, then bam, you're postpartum with a neonate, and you're having even a harder time to get into the dentist. And then you have some kind of dental emergency or major thing that needs to be treated, which is definitely harder to do once you have that newborn at home. Would you agree?
Right, definitely.
So, you know, make sure you keep taking those prenatal vitamins and address anything, especially and understand that these things can still happen in the postpartum period as well. Yeah. So just in general, elective procedures, teeth whitening, cosmetic dentistry, postpone until after you're pregnant. If it's a non-emergent dental condition, we try to wait until the 2nd trimester if we can. If it's an emergent dental condition, then you got to do it whenever it needs to be done, no matter what trimester, because you got to get that taken care of.
Yeah.
Okay, that was that. And now let's go over, let's see if there's anything else on my list so I can stop grilling you. Let's go over some myths. These are some good myths. Okay. We already talked about one. It's not the dentist business whether or not I'm pregnant. Well, it is. It is. You would give them your medical history of anything else. Why not let them know that you're trying to conceive or pregnant for the reasons that Dr. Lorei said. So if you're coming in and you're trying to conceive, then she can come up with a treatment plan for you as far as when you should come in to get your oral health assessed. The other thing, my myth, your oral health does not affect your baby. True or false?
False.
Well, I gave it away. Myth. We already talked about that. It can affect the baby by having preterm labor and delivery. So we need, especially if it's a significant enough condition, so we need to get that addressed. We already talked about whether or not pregnant women should avoid dental work. I think we've all agreed that we should not avoid dental work. And here's a good one that I got a lot of questions about. I hear all the time, pregnancy leaches calcium from your teeth. Is that true?
It is not true. That is one of the myths, you know. Your bones can be depleted of calcium when the body needs it elsewhere, but your teeth are unaffected by that. So no, the calcium stays in your teeth, but you know, our body doesn't make calcium. So again, why important to let everyone know to take supplements and you know.
And in the prenatal vitamin, we're going to have that extra calcium too. The prenatal vitamin plus a well-balanced diet should give you the calcium you need. But if you still are calcium deficient for whatever reason, and the baby needs more calcium, it's not going to take it from your teeth. It's going to take it from your bones. And that is also true in the postpartum period when you're breastfeeding. Your calcium is typically replenished once you stop breastfeeding. So continue to take those prenatal vitamins too. So all the women that are telling us that, and I had someone comment that I've been pregnant kind of back to back, and that's why my dental health is bad, because my babies keep taking my calcium. That's not true.
It's not true.
Sorry. It's not
There's
true.
Something else going on.
There's something else that's going on. And we talked about it here. We're not going to point fingers at anybody, but, keep taking your prenatal vitamin and get your dental health assessed. And then we also kind of talked about this. Morning sickness is unpleasant but harmless. Well, first off, in general, morning sickness is not harmless. We can't get to a position where it's called hyperemesis gravidarum, and that's the more severe form of morning sickness. But in regards to your dental health, we just explained earlier at the top of this that it's not harmless, and it can potentially cause more. Do you treat a lot of women or see a lot of women that have hyperemesis or nausea and vomiting that have had?
Well, I mean, not to that level, but yes, we see a lot of patients that'll come in their first trimester and they're like, I don't know if I can get this cleaning because I'm going to throw up. I feel, and we just do the best we can. We'll reschedule them to come back at a different time, things like that. But we do see a lot of people with the nausea. I mean, I had 3 pregnancies and I was sick for the first 3 months, basically.
Went for every one of them, So that is another thing that morning sickness is not. And we already gave some tips at the top of this discussion on what you can do to help alleviate some of the symptoms and also increase the pH of your oral cavity from all the episodes of vomiting. But I do feel for you because I was one of those people. Okay, so let's talk about this. And we did a video together about it. I'm an obstetrician, you're a dentist. And it seems like if someone needs something done dentally and it's like, we can't get the OB to sign off, we can't get the dentist to sign off, and it goes back and forth and back and forth. And sometimes I'll even write out a letter, and the other way around, and it still doesn't get you anywhere. And I will admit, we are at fault, both of us. Dentists in general and OBGYNs are at fault for not addressing it because for whatever reason. What can we do to make that process better for women? What would you say? And how can we?
Okay, I'm going to tell you what I think. Okay. I think that as a woman, if you have your group of providers that you trust, that are, you shouldn't be meeting me for the first time when you're pregnant as a dentist. You should have a family dentist. You should be taken care of every 6 months, and they should know you. You're OBGYN. You're not going to meet them during delivery. If you have this network of providers that you trust and you feel comfortable with, I think that is a really good start, and you can connect these people and say, I've been going to this person. If you give a thorough medical history, a lot of times some patients will come in with history of a lot of miscarriages or infertility treatments and things like that. And they want to, I did IVF, and I know that I didn't want to do anything that would risk me having another miscarriage. I wanted to make sure I don't eat any lunch meats. I didn't do this. I didn't do that, so they're a little bit more leery about coming in because they want to be more careful and not do anything. Not that what we do will cause that, but
I get it.
A lot of times you understand with, miscarriages, we really don't know what happened. You can't really say why, so we take that part out of it.
Yeah. So I think from an OB standpoint, I think we're guilty of saying, well, it could just wait till you're delivered. And from a dental standpoint, it is, well, I can't do anything while you're pregnant. And what we're trying to say here in this conversation is that that's not true. You can advocate for yourself if it's something that's painful. If you know there's something wrong, there is a safe time. There's safe medications. There's safe anesthesia. There are dental x-rays that are safe to get it addressed. Because, and again, I've seen several issues with women later in the pregnancy that it was neglected, either because they neglected it themselves. Patients have to take some responsibility if they don't go and get, but also because nobody would see them. And then they end up with either an abscess and a major mouth infection. The whole side of their face is swollen up, and we don't want it to get that far. Right. Because then that does become a problem. And that can put you in the hospital with preterm contractions and preterm labor, and then needing something done under even more anesthesia. Because when it gets to that point, you can't just use lidocaine, as Dr. Lorei said. You have to be put to sleep or have some kind of other anesthesia to address it. So just address it earlier on. Get your oral health in check as soon as you can, so that we don't have to deal with those issues later on. And don't be afraid to let someone know you have something going on in your mouth, first and foremost. Because I see that too. They'll tell me about everything else. They'll tell me about they think their toe is this, but they won't tell me that they have this raging toothache in their mouth, right? I'm sure you see
I don't know
too.
why, but some people just don't think about like what goes on in their mouth to be related to anything else or, not important. And sometimes it doesn't hurt. Like gum disease doesn't really hurt, until it's too far and you've lost a tooth,
So what are some good indications when someone is either trying to conceive or pregnant that they might have gingivitis, that they might have periodontal disease? Let's just say it's someone who's not the best at getting their routine dental health. And what would be some of the signs that maybe something's going on and they need to be checked out?
When your gums bleed by just looking at them. Some people, they'll come in after not having been seen for 5 to 10 years and, taking x-rays will get their gums to bleed and they're not doing anything. So again, your body will tell you that you are not doing the right things in your mouth by the swelling in the gums. I notice sometimes like when I overeat and my body tells me the way I feel that this isn't what you're supposed to be doing. So they know, there, like you said, there are signs that they're not doing the right thing or that they can do better, and that we need to clean things up.
I think one of the things too is if you're not the best at going to the dentist and you may brush your teeth 3 times a day, but take some floss and go in between your teeth. And if you start seeing bleeding, something's going on. I know I've done that because I'm not the best at flossing. I'm just not. And I think, everything looks okay. And then I'm like, okay, I'll floss today. And I'll start flossing. I'm like, what? Oh my God. And I'm like, bleeding. My gums are bleeding. I'm like, oh crap. Okay.
Yeah. Bad breath is another thing.
Bad breath. Yeah. So bad breath. So there are things that can be signs that you need to go get things in check. So for all of the women that are out there that are trying to conceive, put that on your list of things to do while you're trying to conceive.
Find a dentist you're comfortable with. Find somebody you trust, ask your friends, and, you got to be somewhere you feel comfortable.
Yeah. And your obstetrician or gynecologist, they know who they like as far as dentists in the community or who they work with. Right. So ask them. Another good place, and I say this every chance I get, whatever insurance you have, you can call and get a list of dentists that accept your insurance so that you don't have to call 75, I'm exaggerating, to find whoever takes your insurance plan. And also for women with Medicaid. Women with Medicaid can still see a dentist, okay? So there's different forms of Medicaid. women that are already on Medicaid before they even get pregnant, you can find those dentists. But then there's also Medicaids that are only applied once you're pregnant. But dental health can still be covered under that. Okay, so once you get pregnant and you get your Medicaid, it's in order and it's in effect. Call a dentist to get in to be seen, especially, and I will say a lot of women that are on Medicaid and don't have insurance until they're pregnant, they're having all kinds of things being neglected, and I'm sure it's going to be their dental health as well. So put that on your list of things to do once your Medicaid is in effect.
Yeah.
Okay, so let's go through and let's answer some questions. Let me see. Oh, yeah.
Hannah is right. Overall health is so important.
Yeah. So Indigo Swirls was saying, I was so scared to go to the dentist when I was pregnant. I'm just going to be honest. I'm not the biggest fan of the dentist. I've never have been.
Well, you don't come to my office.
But that would change. And my dentist is a little uptight, so that might have something to do with it. But why do you think pregnant women are so scared? I mean, they'll go, they will go to the OB, they'll go in, but why are women so afraid to go to the dentist when they're pregnant?
Well, I think there's always a phobia too with dentists. I hear it I hate the dentist. But also I don't think they want to be judged. I don't judge, I'm not judging them, but they don't, they're just high on pregnancy and want to, concentrate on baby. But, we want to help with that.
Going to the dentist should not be any more scary than going to your OBGYN and having your cervix checked.
Yeah, I don't like that.
Right? So just go to the dentist and ask your friends, ask your doctor who they like and who they think is good with pregnant women, because I'm sure everybody has an opinion, and just start there.
Yep.
Let's see. I saw a few come through. Okay. So sugar-free gum helped tremendously to stop me from salivating all day. I would literally sleep with them in my mouth. So we'll talk a little bit about Tylism. Tylism is a form of nausea and vomiting in pregnancy. It's not talked about very much because people don't really understand it. And that's where you might have some nausea. You're not really vomiting, but you're salivating copiously. And you might even have a spit cup with you, a spit bag. And it's just excess salivation, and it's even hard to eat. It falls into that realm. But Tylism, I'm guessing that could affect your teeth as well by excessive salivating, right? Well,
saliva is actually good in that washes away. It washes away stuff. When you have dry mouth,
dry mouth is worse.
Dry mouth is worse. Excess saliva may be uncomfortable, but to not have enough is worse.
It's worse than it. But the Tylism is not very common. I've seen maybe 10 to 20 cases in my entire career, but it is very impressive the amount of saliva that's produced. And it usually, unfortunately, if you have Tylism, it's P-T-Y-A-L-I-S-M. If anybody's watching and wants to look, it is not easy to ignore, and it affects.
Honestly, I've never heard it, and I'm going to look it up.
You got to look it up.
I've been a dentist for 19 years, and I've not heard.
It's not very common, but they will literally salivate and spit their entire pregnancy. It's not something that lasts like nausea and vomiting in pregnancy, and it's mostly over by 14, 16 weeks or so. It's until the day they deliver.
Oh, wow.
It's pretty impressive. Let's see. What else do we have? Great info. Myth busted. Okay. Okay. I have periodontal disease. Will this get worse in pregnancy?
It can.
Yeah.
It can, definitely.
Yeah.
Not just the process, but again, as pregnant, you may not really take care like you would maybe if you weren't pregnant or after baby when you are neglecting yourself. Yes.
Yeah, I think the neglect probably gets a little bit worse once baby's here, because we fall asleep. When the baby sleeps, we forget to brush our teeth. We're eating whatever we can get our hands on. We're drinking whatever we can get our hands on. And so if you already have something that's pre-existing, you should get it assessed. And if you can't do it until postpartum, you got to find a way to get it in and get it taken care of postpartum, because it will most definitely probably flare up in your postpartum period. Yeah. So yes, I had that. I was spitting all day long. I was so uncomfortable to deal with all day long. Yeah. I wrote a paper on it, actually. It's one of my, it wasn't a research paper. It was,
write that down. You said it starts with a P, right?
PTY, Tilism, ALISM. Yeah.
I'm going to look it up.
It's pretty gnarly. Yeah. It literally went the way that the day I delivered weird. I had to have a cup all day. Yep. And the most, and it is more common in African-American women who have Tilism. So there is a predisposition to that, but yeah, it's pretty impressive. So my nurse practitioner blamed it on ethnicity, which annoyed me. She assumed I was Haitian. So no, I'm sorry, I'm not, but it is that, my patient population, the ones that I've seen are mostly, it can happen to anybody, but it is predisposed for African-American women. So, okay. So can you think of anything else we did not cover? I hope that we dispelled any myths. I hope that we've impressed upon you guys how important dental health is in pregnancy and in the trying to conceive period. I think the biggest takeaway for me, and then you can give me yours, when it comes to dental health and pregnancy, is that you should treat it just like you would anything else with your health. When you're trying to get your body in shape for trying to conceive in pregnancy, it should be just as important as anything else that you do. And don't neglect it, because the consequences of neglecting it, especially as you get further in your pregnancy, can lead to an intervention that could have been avoided. Definitely. So that's the biggest takeaway. And what would you say?
I definitely want to go back and talk about, what you can do while you're pregnant. Okay. Again, brushing twice a day, flossing, using fluoride toothpaste. If you don't know what to use, look on the back. ADA approved. It's good. Chewing sugar-free gum with xylitol, using a fluoride rinse, and, going in and getting your regular checkups, taking supplements and vitamins. After you have the baby, it's really important to know about how to take care of your baby and their teeth. When do they go to the dentist? We always say when they first get a tooth till 1, either then or by the time they're 1, you should take them to the dentist. Honestly, a lot of times, we don't really do anything. We see them, we try to polish, we'll put some fluoride on their teeth, but it gets them in that habit. Every 6 months, you'll bring them in. Even if they cry every 6 months, at some point, they're comfortable. So you're starting good habits with your kids. And we can talk to you about sippy cups and how, not to have sugary drinks or milk left in sippy cups for your kids to sip on all day long and have acids in their mouth. So we do a lot of that conversation. So we may not do much with the mouth, in that appointment, but we do a lot of education. So, taking care of you, making sure you have enough calcium as you're pregnant helps, the developing fetus, and the teeth that are developing in your child, and sets them up for, success.
Yeah. So, but along the same lines, I had my kids, I am so overly cautious about their dental care. And that's because I grew up, it was not important in my family for dental health was not important. Now we were underprivileged. I was a Medicaid kid and we didn't have that accessible. I had a lot of cavities when I was a kid. It took me into my adult life to get my dental health in check. So for having my kids, that was something that has been so important to me. And, just to give you a few other stats since you brought that up, we talked about 1 in 4 women of childbearing age having untreated cavities. Also, children of mothers who have high levels of untreated cavities or tooth loss are more than 3 times more likely to have cavities as a child. And then children with poor oral health status are nearly 3 times more likely to miss school because of dental pain. And we may think it's something else and not even realize it's their mouth. So, start with yourself and getting a dental routine for yourself that translates to your children. And all those little things are so important.
So important.
It is so important. So, my kids have started going to the dentist within a week of turning 1, and they go twice a year. And they've gone twice a year. Because overall dental health and just general, we don't have to go into this, but we know that bad dental hygiene and bad dental health can lead to things with heart disease in adults. I mean, it's far reaching. Okay. We do know that.
Risk factor for lung disease. Lung disease.
Yes. Yeah. So we're talking specifically here about pregnancy, but even as an adult, it can have bad dental hygiene and dental health can have impact on your overall health. So it's so important to have that addressed. Is there a certain prenatal vitamin should be prescribed? So, of course, there's a gazillion prenatal vitamins that can be prescribed. I have done videos on the prenatal vitamin that I recommend. I like the Nature's Made prenatal vitamin with DHA. You can get that over the counter. But if you are of reproductive age, your OBGYN can prescribe you a prenatal vitamin if you want something that's prescribed. But really, they're pretty much the same as what you can get over the counter. And there's another one, I forget what the name of it is. Once a day prenatal vitamin. It's a pink and purple label also with DHA. So I would recommend those are my two favorites because they're cheaper and you don't have to have a prescription. So then they have everything that you need if you are trying to conceive or pregnant. Okay. Anything else that we were going to talk about? Yes, that's all I have. This is a good discussion. I think we hit a lot of good importance. Yeah.
Yeah. So and if anybody has questions, they can always, reach out and send me a message.
So you can get Dr. Sarah Lorei on Instagram at Dr. Dr. Sarah, SARAH, Lorei, LOREI, and also on TikTok, where she's really funny. She's much funnier than me. Very humorous, very funny. And you have the most awesome dental office, number one, and the coolest staff that I've ever seen. They are the best. It's like a team. It's like a team thing for you guys.
They're like my kids.
They are. And then you can PM me, PM her here on Instagram. This video will be up on my Instagram TV, on my feed, and I'll post it into my stories. But I think that's all I have.
Thank you so much.
Thank you for doing this. All right. Yeah. Thanks, guys. Have a great day. And thank you again, Dr. Sarah Lorei. And I foresee us doing more TikToks together in the future.
Yes, I can't wait. If you can, and I want to meet in person too.
Where are you at physically? Where's your
I'm in Pennsylvania.
Which part?
Harrisburg area, right in central PA.
So how far are you from Pittsburgh?
3 hours. That's where I went to dental school, was in Pittsburgh.
Yeah, I did residency in Pittsburg. And I'm actually gonna be there the first or second weekend of November, so maybe I'll.
Oh my God, let me know. I might go meet you.
All right, good to see you. Thank you.
Bye.
All right, bye.